Good afternoon or good morning to those of you that are on the West Coast, and thank you for joining us today. The NIA Data Linkage Program is excited to bring you the second webinar in our 2024 webinar series. Today, we're featuring the Understanding America study. Next slide, please. The agenda for today's call will start with a few brief introductions and then cover the webinar logistics, followed by a brief overview of the NIA Data Linkage Program, which will then lead into our feature topic, the Understanding America study. After the presentation, we will have ample time for question and answers. Next slide. By way of introduction, I'm Susan Seifert, the Program Director of the NIA Data Linkage Program. I am joined today with several of my team members and Irma Azam from NIA, who is representing the NIA part of the program. I'm also joined today by Jill Darling and Orla Hayden from University of Southern California's Understanding America study. Next slide. Given the webinar format of today's session, we are requesting that questions be submitted via the Q&A chat box, which can be found in the lower navigation pane. The panel will do our best to answer all of the submitted questions, time permitting. Should any questions remain unanswered, we will follow up with those answers via email. Now, for a brief overview of the NIA Data Linkage Program. Next slide. NIA established the linkage program to address three challenges that researchers face relative to gaining access to CMS data. The first is the time and cost to access CMS data. To overcome this challenge, NIA collaborated closely with CMS to structure the NIA Data Linkage Program so that they will be able to provide quicker access to CMS data at no cost to the researchers. One condition, however, is that researchers must use the CMS data in a federally authorized system that meets all the federal data security requirements. Finally, NIA recognizes that not all researchers are experts in the use of claims data. The linkage team offers knowledgeable CMS data support staff to assist researchers in interpreting the CMS data and assisting in the structure of the research. Next slide. Building on these challenges, the primary goals of the NIA Data Linkage Program is to provide NIA-funded studies and CMS data to authorized researchers in an environment that meets the federal data security requirements in hopes of facilitating high-impact research in the area of health and aging. Next slide. Our comprehensive CMS data inventory available to researchers includes Medicare enrollment data, Parts A, B, C, and D data, the CMS assessment data, including MDS, OASIS, and IRF-PI, as well as access to Medicaid data as necessary. Next slide. The CMS and the study data are delivered to the researcher within the Linkage Enclave, which is a set of secure workspaces where researchers are able to analyze the CMS-linked study data. Each project gets a dedicated project environment, which is accessible to only authorized members of the research team. Next slide. The Linkage Enclave offers a variety of statistical software packages such as MATLAB, Python, R, SAS, SPSS, and Stata. The Enclave also features a proprietary tool called the Job Board, which is a load-balanced, high-speed server farm on which you can launch your statistical programs. Often, these programs run in substantially less time than running in the local environment. Next slide. The Enclave also features a file transfer tool that allows transfer of files into and out of the Enclave. Importing files is generally restricted to code and supplementary files that are approved by the study team for use with their data. Exportation requirements are aimed at supporting dissemination of your research findings and are a bit more restrictive than in that the data export should be aggregate level data with no PII, PHI, or small cells. Data transfers into and out of the enclave require review by both the NIA data linkage program as well as the study. Next slide. Our program offers a three-pronged support structure. The linkage contractor, which is Acumen LLC, offers access to the CMS data, as well as support using that data in the enclave. NIA supports the researchers through the support of funding through grants and the support of the data linkage program, as well as play a key role in the NIA DUA review and approval process for accessing CMS data. Each study, specifically UAS in this instance, offers their study data and associated support in using that data. Next slide. The linkage team can be accessed via email or via phone Monday through Friday, 8 a.m. Eastern to 8 p.m. Eastern. I know that I've just covered a ton of information very quickly, and my team is happy to answer specific questions about the NIA data linkage program in the follow-up question and answer session. Now, without further ado, I would like to introduce Jill Darling, who will kick off the discussion of the Understanding America study.
Thank you. Just trying to find the place to unmute. So thank you for that overview. And hello, everybody. Welcome to the webinar using Understanding America Study, CMS linked data. I'm Jill Darling. I'm Survey Director of the Understanding America Study at the Dornsife Center for Economic and Social Research at USC. Oops, sorry, this is moving without me. I'm here today presenting with Orla Hayden. Orla is the Project Compliance Officer for the UAS's projects in the Linkage Enclave, and we are presenting on behalf of the UAS team who work together to recruit, operate, and maintain the Understanding America study. So the webinar agenda, my role is to provide some background about the Understanding America study, including an overview of the methods and our data collections, which are available for use in the Enclave and for linking to CMS data. Then I will turn it over to Orla, and she's going to give you much more detailed information about the UAS data in the UAS workspace in the Enclave, and also about the linked UAS CMS data in the Enclave. Then, as mentioned already, there will be time for questions. So the Understanding America study, which we will refer to often in this webinar as the UAS, is a probability-based panel of adults living in the United States. The UAS was founded in 2014 by Ari Kaptein, the director of the Center for Economic and Social Research at USC. Ari is an award-winning economist and one of the early pioneers in creating and working with online panels. We recruit the panel in batches over time using an address-based sample frame, which is based on US postal addresses. We use a multi-stage, multi-mode recruitment approach in English and Spanish, and we provide internet-connected tablets as needed. There are just under 15,000 adult participants in the UAS at this time. We are actively recruiting, aiming to reach 20,000 by the end of 2025. We administer about 25 core surveys to the full panel every 2 years, and data from these surveys, as well as other surveys conducted in the UAS, are made available for secondary research under a data use agreement and can be combined with new research done in the UAS. So this is a lot. There is much more online. We have all of our methodology, and we'll be putting up the link to our website at the end, where you can find out more information. So the UAS is a high quality research panel, as I mentioned, with our recruitment and retention rates at about 10% for those who become impaneled. This is comparable and better than other online probability panels that we know of. And as I mentioned, we're recruiting the UAS panel over time. This allows us to use the recruitment batches as refreshment samples to correct for non-response among hard-to-reach populations. Of course, doing so also brings your response rate down because these people are harder to reach, of course. And as you see here, it's running at about 10%. So our annual attrition rate is running at about 6%. That's averaged over 8 to 9 years among this group that we're looking at in the graph, which are batches that we recruited for the UAS in 2014 and 2015. The graph maybe has tiny lettering, so it's hard to see, but the height of the bars is the attrition, and you can see that it starts off high at the very first year, and it tapers off over time. These are yearly from 2016 through 2023. Once participants are in the panel, we see very high participation rates for the UAS core surveys. As you can see here, they're running around 90% for that group. For non-core surveys, which run generally field periods of about 4 to 6 weeks, the participation rates run between 70 and 80%, depending on how long they are in the field. All right, so where does the data come from? Who is funding it? CSER is funded by the NIA and Social Security Administration to collect the data in the core surveys that I mentioned earlier, make it available for other researchers. These are mostly biannual, as I said. There are a couple are annual, and we also have a monthly survey series. The data from these surveys is immediately available to the public under a data use agreement. And by public, I mean investigators affiliated with a research institution who have a DUA on file and an account with us. Data in our repository also comes from other sources such as surveys, experiments, longitudinal projects, passive data collections, for which the UAS serves as a high-quality data collection platform. Such studies are funded by various sources. PIs bring their own funding, which generally comes from federal or other grants, nonprofits, other sources such as financial institutions. PIs can be part of CSER at USC or affiliated with other research institutions around the world. These data are also generally made available to investigators, although it may be after a short embargo period. We also provide our full set of panel recruitment data as well as retention and participation data, which can be used in studying online panel methodology. Ooh. All right, this is moving slowly. All right, so to finish up my overview of the UAS and its data, as I've alluded to, the UAS is not only a database of existing survey data and longitudinal study, but it's also a unique environment for conducting your own funded research. We're a full service survey research operation. Our methodology provides a high quality sample for academic and government research. And we have simple basic pricing that covers all basic data collection, includes demographic, weights, the ability to connect to other data in our database, and to external data, including CMS data in the enclave. In addition, our staff provide a range of expertise for survey and research design, including qualitative work, and as well as subject matter expertise in many areas. So with that, I will now turn this over to Orla to explain what UAS data is available in the UAS part of the enclave and what can be linked to CMS.
Thanks, Jill. I'm Orla Hayden. I'm glad to be here. I work with Jill at CSER, and I'm the Project Compliance Officer for the UAS workspace in the CMS enclave. I manage the applications to use our workspace. I create the project spaces, upload UAS data, and review download requests. I'd like to start off by giving an overview of the UAS workspace and the CMS enclave. The UAS workspace can be thought of as a distinct part of the CMS enclave. The UAS workspace doesn't contain any CMS data. Instead, it contains our UAS data. Access to the UAS workspace requires permission from us, and I'll talk about the application procedure a bit later on. The CMS enclave, on the other hand, contains our UAS CMS linked data, and access to these claims is granted through a CMS application. And finally, we have the linkage program that supplies the UAS CMS link claims into the CMS enclave for researchers to access. The first part of this presentation is going to be about UAS data. I'm going to describe our surveys, the data products we create from our surveys, and the longitudinal files we have so you can track changes over time. I'm also going to talk about our restricted data, the process to apply for access, and I'll give you a couple of examples of projects currently using our restricted data in the UAS workspace. The second part of our presentation will explain what CMS claims are available to link with our UAS data and the application process to get access to these claims. I'll also give some examples of projects that are using that data. So we divide our data into three categories of tiers. Tier 1 is our public use survey data, which includes individual surveys, data products, and longitudinal studies. All of this data is in our UAS workspace, but it's also available to download for free on our website. Tier 2 data is sensitive that either have indirect identifiers or they could bind with other sources to create indirect identifiers. Our most restricted data, Tier 3 data, is only available in the UAS workspace of the CMS enclave. All our data can be merged together using our unique individual identifier called UAS ID. So this slide lists most of the topics we've covered in our individual surveys. In fact, in the last 10 years, we've administered over 600 surveys to 20,000 participants. In addition to the survey response data sets, we also have demographic files for our non-respondents. We have timing files containing the time participants spent on the survey, and we've platform information files containing information about the type of device, operating system, and browser the participant used. We also have a suite of documentation, such as code books and data descriptions to help get you started. The next survey that's very useful in analysis is called the My Household survey, and that collects information such as the participant's age, ethnicity, education, marital status, work status, state of residence, and family structure. The My Household is administered quarterly to all active participants. Active in this context are participants who've completed or updated a My Household survey in the last year. The My Household information provides a quick insight into the demographics of our participants, such as distribution by gender or income. It can also be used to target particular samples. For example, you could ask retirement-related questions to those who are 50 or older. Speaking of retirement, this leads on nicely to my last example of our individual surveys, which is our UAS Health and Retirement Project. You might have already heard of the Health and Retirement Study administered by the University of Michigan. This panel covers a wide range of topics, including physical health, cognitive functioning, work and disability, income and assets, pension plans, health insurance, and of course, retirement expectations. That first survey was administered in 1992, and since then, HRS has been administering surveys to about 20,000 Americans over the age of 50 every 2 years. We conduct the same set of surveys. We fielded 5 waves of data, also to about 20,000 participants, but with some key differences. Our surveys are 100% web-based, whereas HRS surveys are a combination of face-to-face interviews, telephone interviews, and web surveys. HRS only selects those who are 50 or older, but we administer our surveys to every participant over 18. UAS participants are invited to answer the series of surveys every 2 years, just like HRS, but our participants take surveys at different times, depending on when they completed previous HRS series. All right, now I'm going to introduce 4 data products that take some of our individual surveys and then merge them together to make the data easier to use. They're a great starting point to any analysis using UAS data. It's worth noting again that all our data can be merged using our unique identifier, UAS ID. The UAS comprehensive file merges data from several core surveys in the UAS that are repeated every 2 years. So it includes most sections of the core health and retirement study I just talked about. We have 5 waves of HRS data in our current comprehensive file. The harmonized variables in the file are similar in both structure and naming conventions to what's found in the RAND HRS file produced by the RAND Corporation. This was done so users would find it easy to use data from both sources. In addition to HRS data, our comprehensive file contains data on 10 topics from other core UAS surveys. We update this comprehensive file quarterly. The UAS Cognitive Comprehensive File contains a series of cognitive and ability tests that are also administered in the UAS every 2 years. The type of ability tests include word recall, box clicking, and financial literacy. And the 5 cognition tests are number series, picture vocabulary, verbal analogies, stop and go switch, and figure ID. We also add the cognitive tests from the Health and Retirement Survey. The UAS Cognitive Comprehensive File includes the scores from all ways of these longitudinal surveys. It also includes participant and household identifiers, survey completion dates, and a variable indicating response across waves. The next 2 data products were administered to participants who are 50 years or older, and they were funded by the National Institute of Aging. First up is our EMA Burst project that collected a variety of data at various frequencies, such as daily, at the end of the day, and at the end of the week, from March 2020 to March 2022. Participants consented to a 7-day burst of questions. So they download the app, and then every day during a burst, 6 prompts are sent to their phone through the app. Prompts are a phone beep or a text. When they receive the prompt, participants answer about 2 minutes of questions. They answer questions about their emotional and physiological state, what activity they're doing and who they're interacting with, and thoughts about specific issues like money and stressful events. Our UAS monthly events panel dataset is a longitudinal file that merged and organized data from our monthly events surveys, and that started in June 2019 and ran until September 2023. The surveys were fielded at the beginning of the month and asked participants about their experience in the previous calendar month, in particular whether they experienced a number of events, as well as their self-assessments of health, life satisfaction, pain, earnings, and medical expenditures. These monthly surveys and EMS burst data are linked. So sorry about that. So the monthly surveys and EMS burst data are linked. So if certain event of shock is reported in the monthly survey, the participant received a burst. After analyzing the panel data, we decided to change the monthly surveys. So now everyone's surveyed, not just those over 50. Also, the focus is different. Now the monthly surveys concentrate on stress. Our last category of Tier 1 data is our longitudinal studies. Our COVID-19 coronavirus study has 2 longitudinal files, a national sample that was first fielded in March 2020, and then every 2 weeks until February 2021, and then every 4 weeks until August 21. Then it was fielded quarterly until 2023. The second file is the Los Angeles sample, and they were surveyed more often, weekly from March 2020 until February, and then bi-weekly until August 2021. The drug use supplement file tracks monthly variation in drug use pattern and related characteristics. It's nationally representative of about 10,000 participants. Key measurements here include past week use for alcohol, cannabis, cigarettes, and other drugs, along with depression and anxiety symptoms. Our LA Barometer surveys are fielded twice a year to monitor social and economic conditions in LA County. There are 2 surveys, the Livability and Affordability Survey, that covers topics like life satisfaction and stress, housing quality, crime and safety, social engagement, as well as the accessibility and affordability, housing, healthcare, food, and education. The second survey is called the Mobility and Sustainability Survey, and that tracks environmental sustainability, sorry, the slides keep going forward by accident. Let me start that again. So the second survey is called the Mobility and Sustainability Survey, and that tracks environmental sustainability, transportation behavior, and community resilience in Los Angeles County. The survey covers topics like heat and pollution exposure, transportation access, and the steps Los Angeles County residents can take to mitigate and adapt to climate change. One of the projects that I'm going to describe later actually uses this data in the UAS workspace. The last longitudinal study I want to tell you about is our UAS education project. This project focuses on data from UAS households with at least one pre-K through 12 or post-secondary student. Data collection here began in March 2020. The types of data we collect include public opinion about school experiences, the appropriateness of curriculum and books addressing LGBTQ and racial topics, and other contested issues. The second project that I'm going to describe later uses this data in the UAS workspace. Okay, so our tier 2 or sensitive data is the survey data that include potential indirect identifiers, or they could be combined with other sources to create indirect identifiers. We regularly collect complete occupation codes from participants, and it's the second and third level occupation codes that we consider sensitive. Also, some of our election tracking data is considered sensitive. Finally, our restricted data, or tier 3 data, is only available in the UAS workspace of the CMS enclave. We have data for every participant at the GPS, census tract and block, zip code, and county level. We also have pretty much any contextual data that can be geocoded and linked to our UAS survey data. For example, we have the area health resource files, which contains information about primary care physicians, dentists, nurses, and other professions. It also has facility information, such as hospital stays, beds, and services. And this data is available at the state and county level. The US Decennial Census and American Community Survey contains demographic information, socioeconomic characteristics, household features, and housing variables, and is collected at the state, county, census tract, and household level. Uniform crime reports contain annualized rates of crime, such as murder, robbery, aggravated assault, burglary, and car theft, and we have that data at the county level. The nitrogen dioxide, ozone, and particulate matter files are available at the census tract level. Street connectivity data, that contains information such as the number of streets, the total length of streets, intersection density, number of census block and block density, and that's available at the census tract level. We also have the USDA Food Environment and Access file, and that tracks different types of food store proximity and availability, restaurant availability, free food programs, food insecurity, and food prices, along with physical health and activity. And that's collected at the census tract, county, and state level. The weather data we have is monthly. We have heat index, wind chill index, and rainfall at the census tract level. And finally, we have measures of contextual disparities in racism that are under development. It's worth noting here that researchers can contribute their own geocoded data that we can link to UAS data. Other restricted data sets that we're working on adding to our workspace is our participants' Social Security earnings and death data from the National Death Index file. So let's talk about how you can apply for access to use this rich data source. The first step is to go online and set up a free UAS user account. It involves submitting an online form and returning a Tier 1 data use agreement. The next step is to complete and return an enclave application, which is also found online. This application requires a description of your research project and why our Tier 1 and Tier 2 data are not adequate, We'll also ask you to describe all the data required for the project. We'll provide the UAS data to your project space, and you're also welcome to upload external data to your project space too. We're interested in how long you think the project will take and how many analysts will need access to the UAS workspace in the CMS enclave. Once your project's approved, we'll send you a data use agreement to be signed by the research team and an institutional representative. If your institution requires IRB approval, you'll send that along too with a recent CV. And now that you have an idea of the type of data available, let me give you a couple of examples of projects in the UAS workspace. Remember, these projects are only using UAS data, not CMS data, and they're not necessarily funded by NIA. We have their permission to share their project plans, and the first one is exploring the relationship between neighborhood environments and well-being in Los Angeles County. The primary aim is to understand how participants' answers to survey questions, such as neighborhood satisfaction, questions about crime, attitude towards housing developments and homeless programs, vary according to factors such as the socioeconomic and racial composition of the neighborhoods where the participants are living, the availability of services and amenities in their neighborhoods, local housing costs, and local crime rates. This team is merging our census tract restricted data to their survey data. Then they can link the survey data to census tract administrative measures of neighborhood environments. Our second project is using data from the UAS Education Survey. A reminder that this survey measures public opinion about school experiences, including the appropriateness of curriculum and books addressing LGBTQ and racial topics and other contested issues. This team is examining how contextual factors that are available, such as the number and types of public, private, and charter schools within a geographic proximity to the households, may be associated with survey responses. For this, they're using household census block data to link to one or more public school districts. They also hypothesized that participants who've ever been teachers or other school personnel may be more accepting of contested topics in the classroom. And they're using our UAS Tier 2 occupation data for high quality, up-to-date measures of participants' occupations. In this second part of the presentation, I'm going to talk about the CMS enclave. This contains our UAS CMS linked data, and access to the claims is granted through an NIA application. Anyone 65 or over in the UAS is eligible to have their data linked to the CMS claims. If they consent, they provide a Medicare or Medicaid number, or they allow us to use their name, address, gender, and date of birth for matching. As of mid-May, we have 3,066 participants who have completed the consent survey. That's an 84% participation rate. Among those enrolled in Medicare or Medicaid, 45% have consented to the linkage. There are currently 1,072 UAS participants with linked CMS claims, which is based on a February finder file. Our next finder file for matching will be sent to Linkage at the end of the year. We're expecting that the match cases should increase to about 1,400. So here is a diagram of all the CMS claims available to request. We have the Medicare enrollment data. We have Medicare Part A, they're the hospital claims. Part B are the outpatient claims. Part C are the Medicare Advantage Plan claims. And Part D are the prescription drug claims. We also have Medicare assessment data and Medicaid data. This is the NIA data use agreement process. If you look at the legend, you'll see that you'll be mostly interacting with the linkage program to get NIA approval, but the first two boxes are interacting with us. To submit a study data request, you'll follow the steps I previously outlined. Here they are again. You'll apply for access on our website, complete the data use agreement. This time you are going to need IRB approval because you're going to need it for the NIA forms package. And then you'll follow the instructions from Linkage. This involves completing other NIA data use agreement forms and your application being approved by the NIA Privacy Board. The Linkage team will be there to help with the process. Finally, I have a couple of examples of UAS projects that are using the CMS claims. The first is a validation of self-reported chronic conditions. This team are using UAS participants' self-reported chronic conditions, such as dementia and obesity, found in the Health and Retirement Survey. That survey is administered every 2 years. And then they're going to cross-validate these diagnoses with diagnoses listed in the CMS claims. They're going to use the CMS Chronic Conditions Data Warehouse, which identify chronic health, mental health, and substance abuse conditions. For these files, CMS has already developed the algorithms that search the claims for specific diagnosis codes, DRG codes, or procedure codes. The project's then going to generate population estimates for those chronic conditions, which will be compared to other published prevalence estimates. It will also enhance their understanding of the potential biases in the administrative and self-reported data. Also, as this is our first UAS CMS linked data project, it'll produce practical guidelines to facilitate future work using the linked claims. The last project I have for today is a team developing performance-based indices of potential functional deficits. But instead of deriving the indices from self-reported responses, they're going to derive them from how long it took the participant to answer certain survey items. Participants regularly complete surveys, which allows the team to compute indices at several time points. To validate these metrics, the team will compare them to our Tier 1 UAS data self-reports of functioning, such as ADL or IADL status. And then they'll compare them to functioning variables from the Medicare data from a variety of settings like skilled nursing facility, home health, or inpatient hospital. They'll also examine the association between assessments of functioning made by healthcare providers and survey response behaviors. They're going to use our UAS power data, which are our timing files. They're going to use the UAS comprehensive file, the cognitive and Medicare Part A, B, and C. That's the hospital, outpatient, and Medicare Advantage claims. They're also going to use the master beneficiary summary file for beneficiary enrollment information. That's the end of my presentation for today. I think we can open it up to questions.